Why is comparing local trials so difficult? Have you ever tried to compare local clinical trials and felt completely lost? You are not alone. Many patients face challenges when trying to find and compare suitable trials. Let's break down why this process can be so complicated. First, the rules for who can join a trial, known as eligibility criteria, can vary widely. Each trial has its own set of requirements, including age limits, specific disease stages, and previous treatments. This means that even if two trials are in the same area, they might be looking for very different patient groups. This makes it hard to compare them directly. Next, consider the locations of these trials. Even if a trial is nearby, getting to the site can be a challenge. Factors like transportation options, travel time, and personal mobility all play a role. Some trials may offer participation at multiple sites or use modern methods like telehealth, but these options are not available everywhere. Plus, there can be issues with digital access and how medications are delivered. Another factor is the complexity of trial procedures. Some trials requiring patients to make frequent visits, undergo multiple tests, or follow strict monitoring protocols. This can be overwhelming for many patients and might affect their willingness to participate. The differences in these procedures can also influence the types of patients who end up enrolling, which can affect the trial results. Information about trials can often be scattered or incomplete. Patients and their healthcare providers may struggle to find current and detailed information about trials, including recruitment status and eligibility details. This lack of clear information makes it hard to compare trials side by side. Lastly, there are disparities in who gets to participate in trials. Certain groups, especially those from underserved communities, may face barriers like mistrust or cultural differences. This can lead to a lack of representation in trial populations, which can skew the outcomes. For patients looking for local trials, it is important to think about not just the medical eligibility but also the logistical aspects. Consider travel needs, availability of support services, and whether the trial uses decentralized methods that might make participation easier. Speaking with healthcare providers or trial navigators who understand these factors can help patients find trials that are truly accessible and suitable for them. In summary, comparing local trials is difficult due to differences in eligibility rules, access to trial sites, trial procedures, availability of information, and participant diversity. Each of these elements adds to the complexity of finding the right trial for treatment options.